trying to reconnect. And here we are, live with Dr. Todd, who is going to perform a VI peel. Right, Dr. Todd?
Absolutely.
Awesome. All right,
So we're going to tell you a little bit about the VI peel and why you can do these to your friends and families. There are all kinds of procedures that you can do to your enemies, or maybe people that you don't plan to see again. But there are plenty of things that you have to be very careful if you want to actually see the person again, or they're your friend and family. So this is Nancy.
Hi, Nancy.
And she happens to be in our office. And I've actually done this to my daughter. And so since I actually have to see her again, this peel is a wonderful peel because it doesn't over-process. So for those of you who have had peels before, the problem with the peel is that either it doesn't do anything, or it can cause a lot of irritation, pain, and a very irregular response. So then you have an unhappy person. And if that unhappy person happens to work in your office or be in your house, it's not so good. So we're going to talk a little bit about...
So we're going to take good care of Nancy.
We're going to take very good care of Nancy because Nancy takes very good care of me every day in the office, and so we have to make sure that stays that way. So we're going to talk about the VI peel, and there are different types of VI peels, and why we chose this particular one for Nancy. First of all, not all peels can be done down through the neck. And what I like to explain to people is that the face and neck is a canvas, one canvas. And we want to have a smooth, beautiful line. It's just like you don't want to have just a 20-year-old eye and a 60-year-old face and neck. So it gives a nice, smooth transition. And you can even see that in Nancy,
I'm going to bring this a little closer and we'll look at her
Florida
skin here.
That she has some brown pigmentation and irregular pigmentation in her neck. In fact, you see it beautifully here because her chin shields this part of the neck from the sun. So she has more sun damage down in here. So we're going to feather it down into the neck so that there's not a very sharp demarcation line. Some peels, because they go too deep, require you to stop here. This gives a nice, smooth transition. Now, you also can see that she has some brown pigmentation. These are not those friendly freckles that the little redheads have. These are sun changes. And now Nancy's going to smile, which she's mostly doing. She has some little crepiness in her skin, which she doesn't like. Now we can get rid of some of that with Botox, but still the texture of the skin we want to try to improve. Now, she actually has more brown pigmentation on her left side, which almost everyone does because they're driving.
Right,
and
our car window.
I don't understand why they can't make the car windows that filter the ultraviolet sunlight, but they don't. So you will almost find that every patient has more brown pigmentation, and you'll see that we're going to try to really get these spots so that as she gets older, she doesn't have one side of her face that's older than the other.
Okay.
So that's the idea for Nancy and why we've chosen this particular peel for her. And we're going to get started.
All right. So how are you doing, Nancy?
Good.
All right. And tell us a little bit about why you wanted to do this peel.
To lighten or to get these sunspots away, and also to give my face just a better texture and more, youthful appearance.
Have you ever done anything like this before? Have you done a peel before?
No.
No.
First time.
So it's the first time. All right.
Yes.
And
Which is why she's nervous, because she's heard all these horror stories. Okay?
Yes.
but many of us have had this peel and know how effective it is. And actually, once you use a peel, your products will penetrate much better as well. Isn't that true, Dr. Todd?
Yes.
That after you heal from this and begin using your aesthetic products, skincare products, it'll be much more effective for your
This is just a cleansing white to get all of her makeup and the oil from her skin so that the peel will take better. This is not.
And what are you doing there, Jennifer, with the fan?
Oh, it kind of has a scent to it, so this just kind of helps the smell. And also helps any stinging
Okay.
to the skin. Does it feel good, Nancy?
Yes, it does. Thank you.
This cleansing thing doesn't really have this cleansing white doesn't really have that much of a sting to it or anything, but it does kind of smell a little
It's fragrant.
bit. Well, I don't think I would want to wear this fragrance, but it's not terrible, but Some people are more sensitive to smells than others. All right, so now we have the skin with all the oil off of it and everything. And I'm going to take a little bit of Vaseline, and we try to protect the most sensitive areas right by the corner of her nose, because we don't want it to pool in these little areas and have her have a little, if you did, or your esthetician didn't, you'd just have a little chapped area in there. But
it would
like I
be,
said,
yeah,
we don't want that to
staining.
happen to Nancy. So then we just take a sterile and we do several passes. The first pass
Here we go.
I always start, and it's like painting. So you are paint by numbers, you always know where you've been. And I do a very gentle pass the first time. You get an idea of how the patient's going to tolerate it. And I paint it on. I don't scrub it. I do
So
the
it's
lower.
mostly clear. It just has a little bit of a
Well, I think actually they probably
Hint,
put
right?
the color in it so that you can tell.
see where you've been.
Then
It's got a little
I
bit
actually
of
think
a
the
brown
peel
skin.
is probably clear, but if it was totally clear, you couldn't see where you've been. So then I do the lower face where most people want the first, and then I do the
Right.
upper face, and then I go back and I do the neck.
And do you do as many passes on the neck as the face?
I do. I'm not quite as vigorous. You'll see when we get to the next pass. That's okay. So that she's not having any particular reaction to it. I've never seen anybody have a reaction to a peel, but to this particular peel.
Get in here, get
But
it
I
all
always
sorted.
make sure that they're not going to become red or blotchy or anything that.
How you
she's not.
feeling, Nancy? Good?
Fine. Yeah.
Now, on the
Pan's
second
nice.
pass, I always start with the areas where she's got the pigment.
Okay.
And then I rub those a little more vigorously.
So that actually penetrates a little bit
Yep.
there?
You've gotten the oil off with the first pass.
Mm-hmm.
And you've made sure she's not allergic to the peel with the second pass, or she's not having any real. Then I go
reaction.
over the brown areas first, and then I wipe as close, look up for me, Nancy. I wipe as close as I can to the eyelid. If you got it in the eye, it wouldn't blind you, but
Thank God.
I'm an eye doctor.
That's a
You're in the
bonus.
right place.
But they probably wouldn't appreciate it, so we're not using a dangerous product.
Yeah, it would take my
So
eyelid
over
away.
here, remember we had the brown spots over here, so you can tell I'm being a little more vigorous to try to get the brown spots to go away. I mean, I'm not,
It's fine.
I'm not, this is not the Brillo pad peel, okay? This is just a little 2x2. And then in the places where she had the crepiness in the skin around the mouth, I'm being a little bit more.
Be aggressive. Be real aggressive.
But you saw I did the nose, but the skin on her nose is very thin, and it will peel. But I'm not trying to get it to, completely flake off. Now she's gonna put her tongue underneath her mouth. Underneath her lip.
Huh?
Top lip.
Yeah. No,
Top
like
lip.
this.
Underneath.
Oh. What?
Like
Let me
this.
see.
Like chewing.
Oh. There.
That's
yeah.
it. We're going to try to get some of these wrinkles on the top of the lip that people don't like. Now, Nancy doesn't smoke, so she doesn't have a lot of these. But for smokers, it's pretty good. Be amazed. She also doesn't have much pigmentation on her upper forehead or very many wrinkles on her upper forehead.
He's starting to feel a little tingly now.
So that's why we get a little, especially in the areas that and so you see I don't wipe quite as vigorously in the,
Right.
The fan feels great.
On the neck or chest because
well, the skin's
It's a little more sensitive,
bit
right?
more
That's
sensitive.
awesome.
And the other thing is that you're trying not to, you want to get the brown spots, but it's not quite as wrinkly. So we go back over here in the areas where she had the brown spots.
get those spots. And now how many passes total will you do?
Well, mix it all up, and then depending on how her skin absorbs it,
Oh, I see.
I try to get 4.
Okay.
Some people, if their skin is not particularly absorbent, you can get more than that, 5.
And the VI peel has different formulations
Yes.
that you spoke about.
Close. There is one that is for younger people who have a little bit more acne,
Okay.
and that doesn't have the chemical to remove the brown spots because they don't have any brown spots.
Right.
But it's more directed towards getting into the glands for acne. So it's
And now, what will she expect after?
So the
after
nice thing
this?
about this, okay, so people always worry that the peel is going to leave them, unable to work. They're going to have to hide in their house. So, we don't want them to. We give them a kit to try to decrease the itching, because some people have itching. Actually, Benadryl gel, or we give them a gel. Itching is the most common complaint.
Okay.
I've had this done myself, and I thought the itching was the most annoying thing. It kind of, for the
How
first
long
two,
do you itch?
well, the first 2 or 3 days, you can't even tell. In fact, the most common complaint is the patient will call you and say, "It's not working," and then about the 3rd day, it starts to peel. And I kind of feel like it's like Santa Claus's beard and everything, because you get these little patches of skin that kind of flake off like a snake. But it doesn't leave you bleeding and oozing like some of the peels do. I work through it, and sometimes I will, I'll just kind of, you don't want to pick at it, but I'll just kind of, buff it off a little bit. And she will be fine for the rest of the week. And then about Sunday, she may notice that it's beginning to flake off.
Okay.
And then it'll flake for 2 or 3 days. The itching is not that bad. I itch from everything. But some people don't have that much itching. We give them anti-itch cream. We tell them that they can put it in the refrigerator. I think the Benadryl gel. Some people use aloe vera gel. But this is not a painful peel.
How do you feel there, Nancy?
Fine.
Yeah.
This is not a
A little
painful peel.
tingling, but that's it.
At about 3 to 5 days is the maximum amount of peeling. And people, it's not like you couldn't go into a restaurant. Many of our clients go to work.
Right. It just might look like she's had a bit of
Sunburn.
too much sun, and is
Yeah.
peeling from
Yeah,
that. Right?
exactly. That
It's
would be
comparable
exactly
to that.
close.
Yeah.
I've forgotten because I don't ever get into the sun and sunburn.
And I know we have a lot of people ask too, once they've had a peel and they're either actively peeling, should they wear makeup?
You can. I'm one of the reasons my eyeliner and eyebrows are permanent makeup is I'm too lazy to put it on. But Mila has some excellent, our esthetician has some excellent makeup that people can put over. If they're self-conscious about people asking them if they're peeling, they can put it on over it, or they can put their favorite makeup. Some makeup clings to the post-peel face better than others. And so they may want a little different makeup than they usually wear. But, yeah, you can wear makeup.
Wear makeup, and then they have to be very cautious about using their sunscreen products.
Yes, we give them sunscreen, but, we really preach sunscreen to everybody in Florida. The idea behind this is you don't want to get a sunburn.
Right. Doing pretty well there, Nancy?
This is the
Good.
last pass. I'm just trying to make sure I've gotten
good.
every single one of the brown spots. And now you can begin to see, this is the brown spot, the worst brown spot on her chest.
You can really just see that it is a little,
Yeah, you could take off, sometimes people
looking,
have those little
really.
red
She's got a
spots
little-
that they're beginning to worry are getting
redness.
rough and like, precancerous. Sometimes those will come off, but you could see that's a little red now, and that's all. You don't want to leave her bleeding,
Right.
so that's all I'm gonna do for that. And really, she's kind of done. And
look at that. I'm gonna come around on this other side.
How you feel?
Fine. Yeah, fine.
Let's come around.
A little
Look at
tingly.
this. A little tingly.
A little
And
tight.
it'll tingle until it's dry, and it'll be dry in about 2 or 3 minutes, and then it'll stop tingling.
Mm-hmm.
And then it won't tingle again until this evening. We'll give her a post-peel enhancement wipe, and she'll wipe that down.